Dr. Eric Small. I'm a player physician here at the US Open. I'm a pediatric sports medicine specialist at Mount Sinai.
Thanks for joining us today, Dr. Small. We're here live at the US Open, and we've seen a lot of great juniors matches. So today we want to cover injuries in young tennis players. So let's start off with lower back pain. What can you tell us about that?
Yes, low back pain is probably the second or third most common injury in the junior tennis player, but it's the number one reason to miss extended tournament time and practice time. So it's important to know that back pain in the adult tennis player happens all the time, and they can usually play through that. The junior player who has pain for more than a month, we have to have a high index of suspicion that there's a low back stress fracture. So what are the symptoms of that? Early on, the pain usually is just with serving or hyperextension activities such as serving and a overhead. Later on, it'll start to hurt with forehands and backhands as well. And we typically diagnose that on physical exam, pain with extension, but also by an x-ray or an MRI. So as we go along with these injuries, it's important to know, can they continue playing or do they have to take time off? So if there's an MRI or an x-ray that shows a low back stress fracture, that junior player is going to be out for 4 to 12 weeks. So that's important to know right off the top. So typically the treatment is a custom-made back brace, and they wear that for 23 hours per day. And then in a week or 2 weeks' time, once they start feeling better, we will then do some physical therapy looking at to improve the hamstring flexibility and hip flexor flexibility, as well as improving their core strength. Typically, if the low back stress fracture is caught under 6 months, they'll be able to return to full competitive play without any repercussions.
And how about elbow pain?
Okay. Elbow pain, we've heard the term tennis elbow. That actually tennis elbow does not occur in junior players. Tennis elbow is a pain on the outside of the elbow. What happens in junior players is what we call thrower's elbow or pitcher's elbow, which is a pain on the inside of the elbow. And typically under the age of 16, this is a growth plate injury or a stress injury to the growth plate. So typically, if that's diagnosed, they're not able to play somewhere from 2 to 6 weeks. So how do we make that diagnosis? Physical exam. They're extremely tender on the inside of their elbow, and an x-ray will show a widening or an irregular growth plate. The treatment typically will be wrist stretches, wrist isometric such as that, palm up and palm down, and doing that throughout the day, and strengthening the forearm and the shoulder muscles by doing resistance band exercises or visiting with a physical therapist. But typically, if that's caught early, there'll be no long-term problems with that.
And we've heard of runner's knee. Is that common in young athletes?
Okay. In tennis players, knee pain is a common complaint with all the bending and squatting, and runner's knee or patellofemoral pain syndrome is actually the most common cause of knee pain in 10 to 30-year-olds, whether they're playing soccer, basketball, or tennis. And unlike the low back stress fracture and the medial elbow pain in young players, the young tennis player can continue playing tennis with the runner's knee. Typically, the treatment would be bracing the knee or doing taping of the knee in place. Also, reducing their number of lunges and squats and jumping is important. And the strengthening aspect is glute bridges and planks will be helpful, as well as improving their hamstring and hip flexor flexibility.
Speaking of knees, can you tell us a little bit about growth-related knee pain?
Yes, there's a condition in 10 to 15-year-olds that's called Osgood-Schlatter. This presents as a bump below the knee. And what is that bump? The bump is inflammatory tissue, cartilage and soft tissue, that the bones grow rather quickly, but the tendon that attaches the bone doesn't grow as quickly. So it's pulling on the knee. And that's called Osgood-Schlatter. And one can continue playing with that, but very similar to the runner's knee, one would want to decrease the amount of running and jumping and playing for a couple of weeks, and they should be instituting hamstring and hip flexor flexibility exercises and encouraging to do more biking and swimming and low impact aerobic training.
So we've gone from the back to the elbow to the knees. Now about the ankles. What can you tell us about ankle sprains?
An ankle sprain is the single most common cause of a sports injury, including in tennis, and it's probably the number one reason or number two reason for withdrawing or retiring from a tennis match. So that typically happens on the tennis court with a change of direction or backpedaling, and the ankle goes inverts, and sometimes there's a pop and they're unable to continue playing. And 95% of ankle injuries are on the outside of the ankle, but when there's a pain on the inside of the ankle, there's more likely to be a fracture. So when there's a pop or there's pain on the inside of the ankle, that warrants an x-ray to assess to make sure there's no fracture. So grade 1 sprains, typically the young tennis player can continue playing. A grade 2 sprain, where there's a partial tear of the ligaments, the athlete, the tennis player, is unable to continue playing. And a grade 3 sprain or grade 3 injury, which is a tear, may take 2 to 4 months to totally recover. So it's important to get the adequate assessment by a sports medicine physician. So how do we treat the grade 1 to 3 sprains? Well, typically we want to establish range of motion right away to diminish the swelling. We want to do ice, and we want to do some type of a protective lace-up brace, or in a grade 3 sprain, we'd want to do a walking boot probably for a week. Really important, at a week or 2 weeks time, we want to start to institute balance exercises, 1-leg balance and 2-leg balance, and then gradually get back into running and cutting and back into the tennis activity. So a grade 1 sprain, the tennis player can typically continue playing with a wrap. Grade 2 and 3, they'll be out for some time.
Thank you so much for joining us today, Dr. Small from the US Open. Is there anything else you'd like our audiences to know about injuries in young tennis players?
Yes, I think the one important point to remember, there may be different bodily aches after a match, but if there's persistent knee pain or back pain or ankle pain lasting more than several weeks, that should be checked out and make sure there's no stress fracture or more long-term damage. And probably number 2, it's important to keep hydrated and have the nutrition optimized.
Thank you so much for joining us.
Thank you for having me.